Well, hello once again, and welcome to another great episode of Victory in Jesus. I am so excited, I'm so delighted to be able to come into your home once again and talk with you, to share with you all of the great and wonderful things that God has done, is doing, and is yet to do in the lives of His people. And as you know, we always like to come out by letting you know that you don't have any problems because what you have is victory in Jesus. As I say once again, this is our show entitled Victory in Jesus. That's the name that God's given us because we do declare that we have victory in Jesus. So once again, thank you so very much for allowing us to come into your home and share with you the good news of our Lord and Savior Jesus Christ. I'm your host, as you already know, Frank Tony. This is my lovely wife, co-host for so many years, and there's been so many wonderful years at that. My wife, Angela Tony. We're just delighted, as I said, to be able to share with you once again of all the things that God is doing in this Franklin County region and in the areas close in proximity. So we have a great show lined up for you today. You know, we talk about a lot of things here, and I thank you so much for sharing us within the community and the marketplace when we meet you out. You're letting us know what you like and even sometimes what you'd like to see. And I really appreciate that, and I look forward to seeing those times where we can come together and talk about things like that, because this is a show for you. One of our themes are making the connection, bridging the gap between Christ and community. So whenever there are things that you would like to hear or to see, that please by all means let us know, and we'll do everything we possibly can to make sure that it happens on this broadcast. Well, we've got a lot to talk about today. I just want to take a moment to just once again thank you for all that you share with us in the community and what you do by way of praying for us as well, because I know there's some prayers that's being lifted up on our behalf. So thank you again for that. Honey, we've got an awesome show today. I'm going to ask you if you would do the honor of introducing our guest today, because you can do it best.
Well, we're blessed today to have Lori Witcher with us. She's a certified massage specialist, and she's one of Franklin County's finest. And so we're delighted to have Lori with us today, and she's going to talk to us about the benefits of massage. I think we've had her on here before, but she's going to enlighten us on some other areas of massage and why they are important and why it is important to the holistic care of our physical being. So, TV audience, we welcome Lori Witcher and Pastor Wes Witcher with us this morning. Thank you so much for being our guest today.
Oh, thank you for having us on. Thank you. We're glad to be here.
Yes, it is again our pleasure and honor to have you. As we always often like to let our guests know that we know time is so valuable these days, and anytime you take time of your busy schedule to come and share with us here at Victory in Jesus, we want to let it be known that it's just not overlooked, but it is much appreciated. It is greatly appreciated that you've done that. So thank you again for that. Now I want to jump right into, as my wife said, she said, but we've talked before together on this show about some things, but we had such great talk and such little time to do it all. We wanted to come back today and talk a little bit more in depth about some of the things that you shared with us and some of the things that we want to share with our community, because we know that what you have to offer, there was a great need for. But let me just share with the listening audience. I pulled this from your website, and I want the audience to know that you are more than just a pretty face sitting here today. But Liz, I want to share. I found this on her website. It says she's a board certified massage therapist. You said we provide Swedish, deep tissue, hot stone, prenatal massages, on-site chair massage, reflexology, hospice massage, and rotator cuff massage. Let me just ask, is there any kind of massages that you do not provide? You said we specialize in getting clients back to optimal health. Would you talk just a little bit? That's a lot that you offer, but I want you to share some of your expertise, some of your knowledge, some of your training. What brought you to this point that you're comfortable sharing all of these different types of massages? Where have you been as far as education is concerned?
Well, I was educated through Virginia Western Community College. They had a program there back in 2000, And I've also done a lot of continuing educations. I've trained with here recently with some of the greatest minds in the world with lymphatics, with Emil Vader, with Alicia Del Facchio. She's out of Michigan and Florida. She has her own med spa. Also right now I'm training with Bruno Cheekley. He's out of the Sedona, Arizona, originally from France. We're learning LDT with him, which helps to map the pain, to show you where there's stagnation in the body, to help improve and get people better. It is just awesome. I've been using this in my practice now for about a year, and it has been amazing. The Emil Vader, which is manual lymphatic drainage, MLD, I've been using that for like 2 years, and we have had phenomenal results from both. Also, I've been to Richmond. I've trained with Shamaya Cha with medical massage. Also, Alicia Morgan in Hickory, North Carolina. The medical massage is so amazing. It's like me being a chiropractor and a massage therapist all wrapped up in one, getting rid of the total dysfunction in the body. So when we do that, people walk out, they're amazed at what happens to them. But we've trained every year. We have to take continuing eds. I pray about, what I should take. And like the Lord led me into the lymphatic drainage, and I'm just amazed to be training with Molly Clark. She is Bruno Cheekley's right hand. She's in Atlanta, Georgia. But it's like the Lord was telling me, you need to get into the river, you need to get into the flow, you need to get into the water, and you need to get into the healing aspects of what you are doing. So the lymphatic drainage and the MLD, it's more healing. It's actually deeper, it's light work, but it is amazing. But we have traveled all over different states learning from some of the greater people in the world, and we're getting ready to do some stuff with David Morin in medical massage as well. He is an awesome teacher as well.
Awesome, awesome, awesome. So you have traveled extensively, and as you were sharing with us earlier, you are still yet traveling. So this is a field that you never achieve it all. You're constantly growing, you're constantly learning new techniques, new strategies. So kudos to you, good for you, because I want our community, I want our family to be able to know just what you offer, and because there's so many of us that we're dealing with medical conditions, we're dealing with physical conditions, we're dealing with all types of conditions that some of us we realize, then many of us we don't realize that there are therapies, of which therapeutic-wise massages are, and that's what I wanted to kind of ask you a little bit about. How would I know? How is it known that whether massage therapy would benefit me or not? What are some of the things that you would right away know this would help you?
Well, if you're a person suffering from stress, anxiety, you have high blood pressure, your immune system hasn't been good, you're always in the doctor's office seeking pills, medicine, massage therapy could really help you. It could help calm some of that down, eliminate some of those doctor's visits. If you have tight shoulders, your back is aching, you're having headaches. Now, if you're having a migraine, you have to go see the doctor first before you can come see me, because we don't want an aneurysm. We don't want anything like that to happen, so we want to make sure you're out of the clear. Now, if you are pregnant, pregnancy, a lot of women, their backs, their spine, where the baby is, it's moving, the muscles are changing. They need massage. Also, they get lymphedema sometimes while they're pregnant. Their lymphatic system, their legs and their hands and things swell. Basically, mostly anyone can receive massage, as long as you don't have like CVA, you're not going through a stroke right now, or you're having a heart attack. You wouldn't be on. If you have some type of infection that was systemic, I won't be touching you. But there's many like people that have like I said, high stress. Stress is the main thing that causes disease. So all of us have stress, but there are certain conditions in which you cannot have it. But I could basically look at your gait, your walk, your hip, how you're holding your head to see if you merit it. But I would have to know some of your underlying conditions as well, because we might have to talk to the doctor first, to be able to refer you in to make sure he can send me in a prescript to say this is what Mr. Tony needs.
So it sounds like there's a considerable difference between a regular massage and a medical massage.
Right.
Do the people that come for a medical massage, do all of them need a reference from their doctor before they can actually get a medical massage?
Only if they're wanting insurance to reimburse.
Okay.
And if the insurance company like Anthem, Humana, if they're going to be coming in for medical massage and they want to be reimbursed back, then they have to have a referral in from their doctor saying that it is medically necessary that they get massage. Or like if you're on workers' compensation, you know, you've been injured on the job, yes, you need to have a referral in from your doctor to send you in for the medical massage. But if you yourself, when they come in for a medical massage, we would talk about your health, see what's going on, and I would tell you what the medical massage consists of and what it does, and we will see if that's something that would fit you.
Are you finding that more doctors are looking toward alternative medicine such as massage opposed to prescribing more medication? Because a lot of times when doctors prescribe one medication, they often have to prescribe another one to offset the symptoms from the other medication. So do you feel that doctors are in agreement with massages being a part of an up and coming and a greater part of the health industry?
I will say some are,
Okay.
you know, more apt, that are more holistic. They look at, you know, okay, this person keeps coming in with a shoulder bothering them. I'm not going to give them drugs this time. I'm going to refer them into the massage therapist because that's what they actually need. Because sometimes you can get addicted to the pain, you know, like the painkillers or the drugs are supposed to alleviate things. And then people get addicted, and so that's what their body's screaming and crying for. But if they come in and get a massage, which I've had many come in that now are not really going back to the doctor for pills.
Right.
Because they have been able to give up pills. I have a lady right now that has been seeing me for over 2 years. She was on about 30 different medications, and now she's down to 5. And we have worked extensively with her. We've done medical massage on her every time she comes in now, and we get a greater benefit from it. It lasts longer. She feels better. Just regular massage is good for you too, but adding the medical in, it's a whole nother other,
Right.
as we would say.
So if you just come for a massage, you can determine whether it's just a relaxation massage or deep tissue massage or an actual medical massage.
Yes.
You would determine that.
Yes, I would let them know when they come in. Even when we talk on the phone,
Right.
if they give me their symptoms of what's going on, then we consult right then or there. And when they come in the office, I also let them know as well, this would be better for you.
And athletes, I know that there are many athletes out there, young athletes and older athletes that find the benefit of massage. I think it was one of the Cowboy players that after every game he had his own personal therapist and to give him a massage so that he could be optimum in his level of performance when it comes to the game. So there are a plethora of benefits that massage has in and on the body. Would you agree?
Yes, I certainly agree. And I want to, you said a volume of things already, Sister Lori. You touched on one thing that I want to just kind of touch on as well when you talked about individuals taking a multitude of prescriptions, taking many different types of prescriptions, and doctors, they are trained to prescribe medicine, to prescribe pills for conditions. And as you said, many times those pills, they may take care of one symptom, but they will produce one or maybe more symptoms along the way, more problems along the way, so which then they got to prescribe a pill for that problem. Correct. And then before you know it, you end up, as you just said, 25, 30 pills. So for that one who's really taken a lot of pills, now we won't sit here and say that massage therapy is going to eliminate the need for the pills that you're taking, but we can say for certain that it will aid, it will assist, it will give you, if nothing else, an overall well feeling, an overall feeling of health. That's safe to say. Yes, so I would encourage you, family, to consider this. Matter of fact, before we get too far, just in case we run out of time, would you give us your contact information, your website, or where can we find information about what you offer? And we'll try to revisit this again before we finish the broadcast, but I want to just let them know now where they can go and find you.
Okay, you can go out on Google. You can put in www.miraclehands.massagetherapy.com, and you'll see my website come up. And there's like a side that like our home side that tells you all the different massages we do, our price list. You can also call in for other things that we can tell you about. We're also on Schedulicity.com. You can see my schedule all through the week or all through the month to see what is available, what is open. You can actually schedule without even calling me. And then you can give me a little note, this is what I need done. And then what I do is I get your phone number and I call you back to confirm with you so we can discuss what you need when you come in for your session.
Okay, good. So you said
miraclehands.massagetherapy.com.
www.miraclehands.massagetherapy.com. Good. I want to get that out. Then you said I could call you at what number?
You can call me at 540-489-4263, and that's 489 and the word hand.
Okay, good. 489 hand. Wonderful. Then you said Schedulicity. This is a program that we may or may not be aware of. That's an online scheduling system where they can go on and find your services and just schedule an appointment online, and they, then everything will be taken care of from that. Wonderful. Very good. Very good. Listen, I want to go a little bit further into what we've talked about. You shared with us this LDT, you mentioned how do I say it? Lymphedema, yes, lymphedema. Talk to us about lymphedema, because that's going to take us into the lymph drainage therapy that I really want to spend a little bit of time on. What is this lymphedema? What is that? What is lymphedema?
Lymphedema is where the system has been overloaded and we have swelling of our limbs, our legs, our feet, and lymphedema can be on either side, the right side of the body, the left side would be the arm or the hand. You might see people with real big swollen necks, or ladies that have had breast cancer and have had lymph nodes removed, and they get lymphedema from having like chemo, radiation, someone squeezing their arm, the limb just starts swelling because the lymph cannot flow correctly through the body. And if the lymph isn't flowing, that affects your heart, it affects your overall being. Sometimes you will feel so sick and very tired.
Okay. So, and that comes from a myriad of conditions. I think you mentioned earlier about if you're on chemo or radiation, that's a good way to end up with lymphedema. That's just one of the ways that you can end up with it. Or you've had lymph nodes removed, different things. So if I'm one that needs some assistance in that area, could you talk to me about the lymph drainage therapy? How does that help me with that?
The MLD, the manual lymphatic drainage, we have a certain sequence of techniques that we do that we go very gently over the skin. The teacher called it like walking like a putty cat, like a cat over the body so gently. And we have techniques in a series of protocol that we do with the manual lymphatic drainage. But with the LDT, the lymphatic drainage therapy, what I do is I can look at your limb and I can go and map where your lymph is going. I can tell you when it's going the wrong way. The lymph has certain directions that it has to move in. And if it's not, I can reroute it to get it to go the right way. I have worked on people where their feet have been so swollen they couldn't even put in their shoe. And when I finish with them, they are now wearing their shoes again. But the LDT is amazing. Like say for instance, I'm sitting here and I can't move my head, but if I work the lymph of the cervical neck, I can start turning my head from side to side. You can see immediate results. But what's so good about the LDT is because we can map it, your pain, we can drain it, and we can get your lymph system working back to optimal, meaning the best, working the best way possible.
Okay, good. That's good to know, because like you say, many times people are suffering from ailments, and it may be from an old injury, or it may be just from getting older, and we feel like, well, we've just got to live with that, but may or may not be true. That's why it would be beneficial to come and speak with someone like yourself that can kind of give some guidance as to what can be done concerning those type of ailments or conditions.
Now, would they need any type of anything from their doctor to get that type of massage treatment?
A lot of times you need a doctor to refer you in, especially if you've had breast cancer, because I need to know all the lymph nodes that were removed, what's going on, and I'll have to figure out how I need to reroute it, how to map it to get your lymph system flowing like it should. So if you have major lymph, I need for the doctor really to refer you in to me. And I have been doing some advertisement with doctors. I have an oncology area in Roanoke through Carillion that has been calling me and asking me questions because I have a young lady that's coming in, her arm has lymphedema, and I measured her for a sleeve and helped so much with the fluid, and she needs to have the massage not the drainage, not a massage, every day for the lymph because the arm has been swelling a lot because of the type of work she does. Yes.
Good. Well, listen, I want to switch gears, but I want to just say to the family, as you listen to Lori as she's sharing her expertise, her knowledge, I hope that you have began to recognize that this we call it massage therapy. It is a serious treatment. It's not just something where someone can just come in and start squeezing, start pushing, start rubbing on you. But it needs to, I heard you say when you need to know what kind of map to work out. Each individual will be different. Mm-hmm. So I hope that you've been intrigued enough to inquire. But once you do realize that this is something that will benefit you, I hope that you will do your due diligence to make sure that to connect with someone like a Lori and her husband, Pastor West, that they can give you the treatment that you need, because it would be only half beneficial if you just go to someone who only knows half of what they're doing. So that's very important. I want that to be known, that you're not just, I had to use this term, but you're not just a fly-by-night operation. This is something that you have studied extensively and studied long and hard to get the knowledge and the treatments that you have. So that's important to know. Now I want to take just a moment with a few minutes that we have left, because this is a subject that I think we need to talk about. It is a subtle thing that's happening in society today, but nevertheless, it's a serious thing that's happening. We mentioned it earlier, and that's about tattoos. We see tattoos now. Tattoos are becoming like a pair of socks. You've got it's very faddish, and we see it more than we probably would like to see. But you said some things to me earlier about tattoos. Would you share with our family what have you seen with tattoos? What do you know about tattoos?
Well, tattoos are very lethal to the body. Your integumentary system, which is your skin, it covers the whole entire body, inside and out. Once you put that ink on there, it's toxic. It can cause you to have Alzheimer's later in life, many diseases. Recently on television, they were talking about how bad tattoos were. We seem to be going through a huge fad of inking our skin. Mm-hmm. And see, you can't get your skin back. Once it's damaged, it's damaged. Mm-hmm. You can maybe go get the tattoo removed, but then that skin is damaged. So you will need lymphatic drainage therapy to help that toxin get out of your body. See, the lymphatic system, it is so important. It flushes all your toxins, your waste. So if you're putting a toxin in, just imagine what's happening to that skin.
Right.
It's like having cancer, but then you can't reverse it. Mm. Once it's damaged, it's done. Just like cells. It's like once they are damaged completely, when you have radiation done, you can't really fix that area back on the skin from radiation. So tattoos are very lethal. People should really think twice before inking their skin, because your skin is your largest organ in the body. Once that skin is damaged, so say the ink is very toxic, it gets in, well, anything you put on the skin, it immediately gets in, it'll get into the bloodstream.
Right.
It goes all over the body. You may not see it now, but you will see it later. We have conditions now, sometimes doctors don't know why people are sick, but people look at the tattoos, or I'm replacing, I'm putting a memory, I'm putting this on here for my grandma, for my uncle, for my aunt, but they're not really realizing the damage that they're doing to their whole body. And see, their health will pay for it. That's just like when you get those fillings, the mercury type fillings in your mouth. Mm-hmm. It causes so much damage to the brain. Mm-hmm. Every organ is affected from tattooing.
Mm. And that's why touch is so powerful. You said that the skin was the largest organ within us. And that is why touch is so powerful, and that is why massage is so powerful. And that's why we have to be careful where we go and how people are touching us, and that they have the right spirit and the right motive behind the touch, so that the touch doesn't become perverted, but it can be a source of healing and not a source of perversion.
Yes.
Very good, very good. I wanted to, just for a moment, I heard you say one of the results that's been proven scientifically is Alzheimer's. Did you say Alzheimer's? When it comes to tattooing, these are one of the things, aside from cancer itself, Alzheimer's is another condition that comes as a result of putting this toxin within your system.
Yes.
Okay, I wanted to make sure I heard that, because that I didn't make that connection before until I heard you say it. So those are serious prices to have to pay, paying twice. Yeah, I paid for the ink, but now I'm on the backside. I'm going to have to pay for the ink with my health,
correct,
with my physical health. So and I wanted us to talk a little bit about that, because I've heard individuals, young as well as not so young, say when they got the first tattoo, it became addictive, that they wanted the second tattoo and the next tattoo and the next tattoo. I've heard that more than once. So that kind of sends up a red flag to me that maybe this is not what God wants. Maybe this is more of what my flesh wants more than what God wants. So thank you for sharing that. That is so important for us to know. Now, I've got just a few moments left, and I don't want your husband coming today to be in vain. We spent this time talking about, the drainage and massage therapy, which is so, and I must say that we believe in massage therapy. Some do, some don't believe in it, but I know that, as you said a moment ago, honey, that the touch, the sense of touch, when it's done in the Christ-like fashion, even babies, when they come out of the womb, they desire that touch. And there is a scientific fact that the babies that doesn't get the touch, they're not as productive. They're not as
They die.
They die. They die. So that touch is very important. So if someone's going to touch me, I want to make sure, when it comes to therapy, I want to make sure that they know what they're doing.
And they're of God.
So thank you so much, and they are of God. Thank you so much for taking the time to study and to learn and to answer the call that God has given to you. And certainly thank you for the time that you've shared today. But I want to switch just for a moment, because your dear husband is with you today, Pastor Witcher. We call him Pastor Wes. Pastor Wes Witcher is with us today. Pastor, good to have you on the show today as well.
I'm glad to be here. Thank you.
Yes, sir. Good to have that. The church that I understand that you're a pastor in the church. Tell us the name of your church.
I am in Alta Vista, Virginia. The church is First Church of Jesus, located at 1208 Franklin Avenue in the heart of Alta Vista, Virginia, where we preach Jesus and love his people.
Amen. Well, thank you so much for answering the call as well, to the call of ministry, because Sister Lori, First Lady Lori, however you want to be recognized, Lori is answering the call to the man in one way, but then you're answering the call to mankind in another way. So with the two of you working together, I would call it an awesome team.
Amen.
Thank you so much for that. And I understand that God is doing some great things there in Alta Vista as well. So I want to salute you both for what you're doing. And although the folks in Alta Vista may not be able to get this local channel, they can look up on the internet. They can dial us up on the web at Cable 12, or as you said, Google it, or YNN.com, and it'll bring them to Cable 12. So they would be able to see that as well. So we'd love to have them to join in on us and view what we're doing here. We just believe that God is doing a great work here. And I understand that it's been spoken that you're the up and coming mayor of Alta Vista. So.
I receive it. We have been working really close with the town of Alta Vista. We've been working really close with the police department, the chief and the captain. I met with them on yesterday, town council, and we're getting involved. You said something earlier about being involved in the community and bringing the people together and in a godly fashion. And that's what we're doing. We love what you're doing with this program, you and your lovely wife with this program. I went online and I saw the interview that you did with Miss Muse a little while back, and it was just awesome. You're doing an awesome thing. And with my mentor, Dr. Penn, the interviews, you're all doing a great work, and we're just glad to be here.
Well, thank you so very much for being here. It's our pleasure. It's our honor to have you today. And as I wish I had more time, we could talk more, but our time is gone. But I do want to again remind you. Tell me once again your website.
Is miraclehands.massagetherapy.com.
www.miraclehands.massagetherapy.com. Why is that so difficult for me to say today? I don't know. But thank you so very much for coming to the family. Thank you once again for this time that you've allowed us to share. I got to tell you, I'm on my way out, but I have to tell you, you don't have any problems because you have victory in Jesus. May God bless you. May heaven smile upon you. Until we come this way again, I pray for you and you pray for me. We love you. God bless you.